Good morning, everyone. It's Mary, a traditional Chinese medicine tutor and an acupuncturist in Canada. Today's video records a full Moxibustion treatment section for a wasp bite on me. 2 days after being bitten by a wasp, the wounded area became even redder with more swollen, pain, and itching, and it expanded towards the direction of the heart. I only did bloodletting on day 1 and day 2 without Moxibustion. On day 3, as the infection worsened, I added Moxibustion along with bloodletting. The bloodletting and the Moxibustion techniques used together worked very well. On day 4, the wound area was much reduced, and I did one more round of bloodletting on the relatively redder spots, followed by about 5 minutes of Moxibustion. On day 5, I did not do treatment on the wound. I almost felt no unusual sensation, though the area was still slightly redder than the surrounding area. On day 6, everything became usual. When a wasp stings on people, venom or toxin will be injected into humans and cause the infected area to become red, swollen, wounds to the touch and pain. This is usually called cellulitis in Western medicine. Depending on the person's level of zhen qi or healthy state, some people might get over it in several days. Still, in some severe cases, without the proper treatment, the red and swollen in the infected area will expand and move towards the direction of the heart, which is a sign that the condition is worsening. If the condition is recovering, the redness should be fading, and the swollen and pain should be reduced and disappear. Other animal bites, like mad dog bites, may lead to more severe consequences, like rabies. Traditional Chinese medicine's approach to treating animal bites usually involves Moxibustion. Moxa is a young herb and is quite effective in expelling toxins out of the body. For example, to treat a dog bite, which usually involves people being bitten on the lateral part of the leg, where the gallbladder channel goes through, Moxa on a ginger piece will be used on the wound. Afterwards, Moxibustion on Wai Chu GB36 should be applied. As an empirical point, Moxibustion on Wai Chu GB36 can strengthen the effect of dispelling toxins from the body. When a Moxa stick is used, in addition to focusing on the animal bite wound, the edge of the infected area can also be applied by Moxibustion, especially the end towards the heart. Combined with Moxibustion, the bloodletting technique is sometimes integrated into the treatment to create outlets for the toxins to leave the body. While doing the Moxibustion treatment, I rambled about the application of Moxibustion over cold-induced conditions. I also discussed the meaning of inflammation and whether a heating pad or cold pad should be used for inflammation. If you would like to skip the intro, you can jump directly to the start of Moxibustion treatment part, starting at around 11 minutes. Without further ado, let's start. Today, I'm doing a video about how to use Moxibustion to treat the damage caused by wasp bite. That was unfortunately happened to me 2 days ago. A wasp bit me here on my pinky. Did you see here? It was extremely painful. I immediately went back home, got my 3-edged needle, and I did bloodletting in the place where the wasp bit me. You can see those little dots, kind of like the wound left by the wasp bite. The red swollen was instant after being bitten by the wasp. After bloodletting several places in the pinky, I felt better, less painful. The swollen looked like it had stopped, or at least at the moment. Yesterday in the afternoon, I felt it was itchy again. I observed the swollen became bigger, diffused to other parts, kind of like making a circle in the pinky. So I did a bloodletting again, because it was so itchy, kind of cannot help but scratching on it. Then, at the middle of the night, at around 2 o'clock, I woke up by the pain, by the incredible itchiness and the distension sensations of my finger. So I checked my finger. It was swollen. The swollen increased. It crossed the joint, the second joint of the pinky, to the fingertip and towards my palm area. I felt a little bit swollen as well. It was so itchy and had a burning sensation. So again, I got the needles and did some bloodlettings in the middle of the night, 2 or 3 o'clock in the morning. Today I woke up in the morning, I saw it. The swelling shrinks smaller, but still there are swellings here. See here? Did you see? Here. Did you see the little dots? That is what I poked yesterday. So you see this part is still swollen. So I was thinking, so bloodletting obviously works, but haven't totally healed. This is not the first time I was bitten by wasps. It is the third time or fourth time. One was on my big toe. Another time it bit me somewhere in the palm. Each time when I had this problem, what I did, it was bloodletting first and then immediately followed by Moxibustion. 2 times worked very well. In just 2 or 3 days, all the pain, swollen, disappeared. It works very well. Bloodletting with Moxibustion can help the situation. But this time, I only did the bloodletting because originally I thought it should work enough. The bite was not that big. Even the pain was not as big as I experienced before. So I just being lazy and decided just to do the bloodletting. Now it looks like it didn't work that way. So I was going to resume the method of Moxibustion. See here, it's so pink. That's the inflammation. Usually in traditional Chinese medicine, if you see the manifestations of the skin have the characters of redness, swollen, burning sensation, and pain. If they have these 4 characters, red, swollen, burning sensations, and pain, they indicate heat pathogen. When the skin invaded by heat pathogen, bloodletting is always indicated. If not say always, it's generally indicated. By bloodletting, the toxins or the pathogens will have outlet because heat toxin, they belong to Yang. Yang has the character of going outwards. If the wound is caused by the attack of heat pathogen, you open the outlet like they do the bloodletting. Following the escaping, the running of the blood, the heat toxins will also leave the body. So the problems get solved. That's basically the idea of why you use bloodletting to treat the heat toxin induced problems. When it comes to Moxibustion, usually the Moxibustion are used for cold-induced diseases. For example, if you have cold belly, if you touch your belly, it's cold, or your feet, like some people year-round, even in summer, the feet are very cold. For those situations, the Moxibustion is indicated. Here I have one. This is the Moxibustion stick. Inside of it, I can peel part of it. Inside of it, there are Moxa. That's the Moxa, you see. The Moxa are a specific type of the herb. This herb belongs to Yang herb. If you use Moxibustion, it can increase your body's Yang, reinforce your body's Yang to fight against the cold pathogen or expel the cold pathogen out of your body. When people have heat-related problems, like people have a fever, you are not supposed to use Moxibustion. However, there are some exceptions. As the general rule, Moxibustion used for cold-induced diseases or the cold syndrome. But for some problems, for example, people was bitten by a mad dog. You know, they have toxins inside. Or by wasp, like what I'm experiencing now. Those situations are indicated for Moxibustion. You can use Moxibustion. Another case, like shingles. You know, people have the shingles, usually on their back. The Moxibustion can be used as well. Now, for my wasp bite, the bloodletting is not sufficient, so I'm going to follow the way I used to do and followed by Moxibustion. Before I forget, there's one thing I need to mention first. That is, after Moxibustion, it is suggested not to drink water at least within an hour. At least within an hour, don't drink water. Now, I'm going to show how to do the Moxibustion. First, you need to prepare several things. Moxa stick, lighter. I prepare a candle, so it's easier to make fire. A cup of water. This is used for the ashes. When you burn the Moxa stick, there will be ashes, so you use it to hold the ashes. This one is a can. What I used is just a leftover expired instant coffee. Usually you prepare a container with the sand inside. After you finish your work, you need to put out the fire, so it's safe to put it inside to prevent any possibilities of catch fire. That's all we need. Today I'm doing outside because it's spring, May 1st, 2025. Outside is not that bad. If it's winter, I will choose to do it inside the room. When you do it inside the room, you need a ventilation system like a fan to expel the smoke out of the room. Otherwise, the smoke will go inside your lung. It's not a good idea to do so. First, I'll go with my candle. So here we go. This is the fire. Fire in TCM belong to Yang, so you see the fire is ever in movement, always flames upward. So you use the top fire. Yeah, it works. It works, right? So here, do the side to get everything ready. What I do is just like this. You keep some distance. 100% you cannot use the burnt stick to touch your skin. That will damage your skin. It's impossible to do that. Keeping the distance towards the skin where they are swollen. The distance is different depending on your own sensation. You should feel warm. If too close, you will feel burning. If too far away, the effect will be compromised. So you always look at the distance. Here you go. You look at the distance, pay attention to the feeling of it. You see the red spots, the red ones. I was kind of like do the Moxa on the edge of the red patches. Kind of like by doing the Moxibustion along the edge of the affected area. You push the boundary of the affected area smaller. You are kind of like fighting against the enemy. The Moxa reinforces the Yang Qi of the body. This Yang Qi can fight the pathogen, which is toxin inputted to me by the wasp. So I go with the edge, feel very comfortable, especially like the itchiness. So I use this. And this side as well. See here, there is redness as well. Did you see this? So yeah, it's very red in this area. So go like this. The swollen, you can see it's getting smaller and smaller or even disappear. Here you see there's ashes here. There are ashes here. Then use the cup holding water like this. So you see. Yeah. water, the ashes fall in. So continue. One part, when you feel it is hot, you can turn another part, just make circle along the edge of the swollen and the red area. They have the distinct edge. Today's situation is better than last night. Last night was totally swollen. Now I can see clearly the edge as well. Usually, the time of doing Moxibustion will be depending on the size of your infected area. Usually, you look at the surrounding area becoming pinkish, because when you do the Moxa, this Moxa is a young herb. It attracts the qi and the blood to this area. More qi and blood being attracted to this area, to the diseased area. There are sufficient qi and blood. We call it zhen qi. Our own army can fight the enemies. That's what I'm doing now. Yeah, I feel comfortable. I feel the itchiness in this part, the inside of it. This is the part where the wasp bit on me. Yeah, so I'm going to work on this. I think my area where I'm living has a lot of wasps. One summer, there are some construction workers working on the roof, working on my neighbor's roof. I heard that 2 workers had been bitten by the wasps on the head. That was crazy. I was wondering what happened next. If bitten on the head, it was swollen. You know, the head inside is the brain. The inflammation will be really big. So-called inflammation, that's a Western medicine term. TCM would translate it as being attacked by heat pathogen. So they have the manifestation of red, swelling, burning, and pain. That's called inflammation. It is in case like that, being invaded by heat pathogen, or only in that type of the inflammation, you can use ice pack. Use the cold to balance out the heat. That's okay. Generally speaking, TCM practice does not suggest ice pack due to the reason most of the diseases are caused by the cold pathogen. People got cold, can be the cold environment or the air conditioner. For that situation, you use the cold pad would make things even worse. You see here, the ashes accumulated here now. So again, I use this to get rid of the ashes. The ashes are very hot. Even though it's ashes, you don't let the ashes fall onto the skin. The temperature is really high, it can burn the skin. Be careful. You shouldn't let the ashes fall onto the skin. You need to observe it. When you do it, observe the condition of the ashes. So that's here. Yeah. Now I'm moving my fingers. It feels more flexible. In the morning when I woke up, the skin was kind of extended because of swollen. And I felt numbness. And the movement was kind of very uncomfortable, restrained in certain ways. Now feeling a little better, so I'm going to continue with this. Actually, from what I can see now, the red swollen part, it's getting smaller now. I can see the edge is retreating. The center now it's moved to this area. The center becomes more obvious because the edge has been shrinking. What I'm doing now is more on the edge. Now the edge becomes clear. Or just working on the edge, surrounding this area. Yes. It's kind of like I'm surrounding the enemy and they will shrink, and then disappear. That's what I'm doing here. We just mentioned the heating pad or cold pad things. TCM does not 100% say no cold pad at all. It's not like that. It's only because many diseases are caused by the cold pathogen, like coldness, dampness. That's why the cold pad shouldn't be used for conditions caused by the cold pathogen or dampness pathogen. The inflammation is something, I think people use it too randomly. If it has the manifestation of red, swollen, burning sensation, and heat and pain, that is inflammation. But nowadays, it feels like people randomly say any pain, they say it's inflammation. Once I had a patient, she said her chiropractor said she had an inflammation because she suddenly could not move her back. She felt pain on her back, and she even had to take a day off and rest in the bed. She went to see a chiropractor, and she was told that there was inflammation, and she was suggested to put on ice pad twice a day, each time for about 15 to 20 minutes. After applying ice pad, her condition became much worse. So she called me and wanted to see me. After communicating with her, I told her that for this situation, very likely I would use fire cupping. Use the heating pad, so it is in conflict. Totally opposite approach to treat the sudden frozen of the lower back. In my idea, it's very likely caused by the cold. It was in winter. She went out and stayed outside for quite a long time. So I have to decide what's the cause of it after I saw this patient. She agreed with my advice. I did the fire cupping on her. It worked on her condition. She said inflammation. Inflammation, if it's caused by heat pathogen, ice pads, it's indicated. But if it's caused by cold pathogen, then if you call it inflammation, you need to think twice about the treatment. If you use inflammation, the term, on every situation that has pain, my idea will be not all the inflammation you can use ice pad. You will need to identify the situation to decide to use it or not. I'm still working on the edge of it. It takes time. Moxibustion, the meaning of it is long fire. That's the Chinese word, 久 and 火. It needs your patience to work on it slowly, take time. That's one of the reasons why people hardly can persistently do this, because you have to carefully concentrate on this for a long time. Yeah, now you look at this, I can see the edge of the inflammation or the edge of the redness becomes more clear and clear now. From time to time, you need to get the ashes away. For the Moxibustion, there are many different ways of doing it. This one, using the Moxa stick directly on top of the areas, because these places are very slim. If you do it for the case of cold belly, the tummy is cold and the feet are cold, you're going to do Moxibustion on the belly. There's one point called CV4, 关元. That's where the 丹田 located. In that situation, we usually use different type of Moxibustion. We use a piece of ginger and then put the Moxa on top of the ginger and light it and work on it. That's the general way of doing Moxibustion. Of course, you use the Moxa stick, it also works. In some situations, for a certain spot, you can directly use Moxa on top of the skin. You put some Vaseline on the skin and then put a piece of Moxa on top of it. We will be careful to observe the process. By all means, we don't want the fire directly burn the skin. Usually, when the skin feels warm, we're going to remove that part. Now, I'm just working the regular ways on my wasp bite. That's pretty much like this. I have been doing it for about 10 minutes. It is okay now. The color, if you look at it, the color is fading. Now, I'm just going to stop Moxibustion and I'll see how it goes. Sometimes the result is not immediate, like you cannot see it right away, even though you feel better, of course. But after some time, the body works itself. Our army is still fighting the enemy. Your Moxibustion gives strength to our army, so they can continue to fight it. We'll see. I obviously feel better. Like the itchiness and the sensations are getting more normal with my pinkies. So that's it. Now I have finished this session of treatment by Moxibustion. What I do is going to put out the fire. So as I said, you can put sand in a container and then you just put it in. This is the way. Put out the fire. This is the way I'll put out the fire. So yeah, it is that. I'll just leave it here. Sometimes you thought it's already put out, but not. So leave it like this until you're totally sure it's put out. It will not cause fire hazard to your home or to your working places. Okay? Thank you for watching. Have a great day. Bye.